My name is Tosin Omolaja, and you are welcome to NAFDAC and your Health, where we bring you all the important information you need to know about NAFDAC. The agency is saddled with the responsibility of safeguarding our health by ensuring that the foods, drugs, cosmetics, and medical equipment made available to us are safe and wholesome. NAFDAC's mandate of safeguarding the health of the nation goes beyond regulatory and enforcement activities to ensuring that the public is adequately sensitized about what they consume, whether it is food or drugs or cosmetics and even medical equipment. And from time to time, the agency embarks on several public enlightenment campaigns. So today on the program, we join the Director General of NAFDAC and other related health policymakers at the flag-off of another round of the agency's sensitization campaign, targeted at 8 states of the Federation in its pilot phase.
It is indeed a great pleasure for me to welcome you all to this very important and significant sensitization scheduled to hold in 8 states of the Federation. The first phase of the sensitization campaign we hold in selected states across the country from August to September 2021. Public awareness campaign is one of the veritable regulatory mechanisms put in place by NAFDAC to promote and protect the health of our people. A well-informed, sensitized, and educated citizenry is the bedrock of effective regulation. This is why today's event is another major milestone in our bid to protect Nigerians against the deleterious effects of unwholesome food, falsified medical products, harmful cosmetics, poor water, and other substandard regulated products. The key objective of this sensitization program is to intensify and expand the scope of our informal and formal behavior change communication strategy in order to reach the vulnerable communities, especially at the grassroots. Dissemination of food and drug safety information is an important aspect of our regulatory work. It is a common knowledge that Nigeria has a lot of issues with falsified medical products and unwholesome food. The advent of COVID-19 pandemic has aggravated the problem with the challenge posed by substandard and falsified personal protective equipment, PPEs. The sensitization campaigns will therefore contribute significantly to the federal government's concerted efforts to inform, sensitize, educate, and alert the public about inherent dangers of intake and use of those spurious regulated products. The campaign themes are multifaceted, with clear, concise, informative, and educative messages aimed at arousing the awareness and consciousness of the general public about the various infractions that impact negatively on our healthcare delivery system.
The public health issues that this current campaign will tackle include dangers of buying medicines from hawkers, encouraging the public to only buy medicines from licensed pharmacies and medicine stores. It will also tackle the abuse of codeine and self-medication, especially among youths. The dangerous effects of using kerosene tankers to load groundnut oil, the use of potassium bromate in baking bread, and azo dyes in palm oil production, both of which puts the consumer at the risk of cancer. The sensitization campaign will also highlight the dangers of preserving any type of food or attempt to keep flies and other insects away by using chemicals like sniper. The dangers of trans fat and consumption of excessive oil, use of formalin in food, the dangers of wrong use of pesticides and insecticides, the wrong use of chemicals and its hazardous effects. Other critical public health concerns that this campaign is designed to tackle also includes education on how to handle antimicrobials and other health issues, and indeed enlightenment for mothers and nursing mothers on the benefits of exclusive breastfeeding.
Low level of exclusive breastfeeding practice by lactating mothers and its associated health hazards. This year is the 40th anniversary of the code that encourages women to breastfeed for the first 6 months, fully breastfeed for the first 6 months. So part of our campaign will arouse awareness that this is extremely important. The target audiences are market women and men, road transport workers, employers, community youth, organizations, and students. We have engaged the services of MMCC, that is Mr. Onilu's company, as project consultant to drive the sensitization campaigns, and it is gratifying to note that the campaign materials are ready to be deployed on the field. It is our expectation at the end of the campaign that the participants and target audiences will become dependable partners and allies of NAFDAC and be in the forefront of sustaining the public awareness campaigns by disseminating the information and messages to the grassroots. Our ultimate goal is to ensure that the various communities take ownership of the care and management of their own health. Distinguished ladies and gentlemen of the press, it is important to note that this sensitization program could not have been possible without the support and encouragement of distinguished members of the Senate Committee on Health and honorable members of the House Committee on Healthcare Services. We thank them. On this note, I want to express my sincere appreciation to the chairman of the Senate Committee, Senator Dr. Ibrahim Oloriegbe, and his counterpart in the House Committee, Honorable Dr. Yusuf Tanko Sununu, for their invaluable contributions and support for this program and other regulatory activities of the agency. I also wish to thank the members of the press for your unalloyed support. We will continue to count on your collaboration as the agency intends to organize in phases and stagger the sensitization campaigns to cover all the 36 states of the Federation within available resources. I would like to thank all the directors in NAFDAC and the staff indeed who have worked tirelessly to make today happen. In conclusion, I want to reassure you that NAFDAC, under my watch, will not leave any stone unturned in our concerted efforts to rid the country of the menace of falsified medical products, unwholesome food, harmful cosmetics, poorly packaged water, and other substandard regulated products. Once again, I thank you all for gracing this occasion. God bless you all. God bless NAFDAC. God bless the Federal Republic of Nigeria. Thank you.
NAFDAC and your health will be right back. Please stay tuned. Welcome back. If you are just joining us, you're watching NAFDAC and your health. The Chairman, Senate Committee on Health, Senator Ibrahim Oloriegbe, and Chairman House Committee on Healthcare Services, Honorable Tanko Sununu, were on hand to lend their support to the agency.
The sensitization campaign is one of the key pillars and components of healthcare delivery, which is prevention. As the common saying goes, prevention is better than cure. While NAFDAC mandate is to regulate the production, marketing, and consumption of food, drugs, cosmetics, and other products. But it is essential and necessary for the citizens to be empowered with necessary knowledge and information on what is unwholesome food, what is falsified drugs, what are harmful cosmetics or harmful products, so that they, on their own, will be able to, even before NAFDAC regulates, prevent the use or the consumption of such products and assist NAFDAC in terms of identifying those that are producing such. So this campaign, therefore, is aimed at providing necessary information and knowledge to citizens across board, particularly to those that are marketers of products that NAFDAC regulates and those that are consumers of such products. And when we talk about consumers, it's virtually every citizen of the country, so that they'll be aware of the danger in using such products or items as far as it affects their body. For them to be able to know that certain things, that some are engaging in some practices, particularly in terms of food falsification. When you talk about the use of formalin to preserve food, the use of snipers and so on, people do this probably without knowing the danger it causes to human health, because they will just say, oh, I want my food to be well prepared, well protected, so that I can sell, or so that it's not damaged. The damage they see is the physical one, but they don't know that the chemical damage that such use, the use of such chemical causes, is much more harmful than even the physical. The physical, once anybody see any food spoil, you won't take it. But when it has some chemicals in it, which damages the kidney, damages the lung, damages the liver, it is much more. And as well, we know in Nigeria now we have so many people with kidney failure. We see every day social media people asking for money for people to have dialysis or to have kidney replacement. So the essential thing is therefore that Nigerians are empowered with necessary information and knowledge for them to be able to support NAFDAC, for NAFDAC to achieve its mandate.
We notice that there are a lot of practices that are injurious to people's health. So we agree as National Assembly to partner with NAFDAC in addressing such issues. Because the more we address them, less people will become sick and less demand from people's pockets to maintain their house. Especially, let's take, for example, it's also part of a House of Representative resolution when somebody raised off and brought a motion calling on NAFDAC to intervene in stopping food vendors from using paracetamol to fasting cooking of their food. And you realize that such kind of practice, the liver being the filter of the blood in the body, can easily be damaged. And once it's damaged, liver can easily transform from disease cells to cancerous cells, which would be definitely detrimental to this thing. We also know that a lot of people are using drugs that are not really meant for the purpose they are used for. And these are all our things. We also notice that there are a lot, as mentioned by the director, during the COVID, importation of genuine products are far going down. So a lot of people now resort to going a short way of producing such kind of drugs that may likely called a fake drug. Fake drug has a lot of issues. One, it may be injurious because we have not tested the product. Two, it will deny you from taking the right drugs. Three, it will allow also the disease to proliferate to reach the extent that something cannot be done easily. Lastly, it also brings economic downfall of a society. So these are all net problems that we thought all we can do is for the National Assembly to partner with NAFDAC so that we can educate people, so that we can, through that education, we can empower them to reject what is not good for them and also to go for what is better.
This sensitization campaign will be deployed using integrated communication approach to ensure that the target audience are reached and the campaign is effective and productive.
The important thing we need to do is to conduct integrated communications model. By that, we are bringing a combination of many strategies because the audiences vary. and their media of information also vary. So somebody you might reach through radio, you may reach another person through TV, you may see somebody on the street, some people in the market, some people in the motor park. So you have to integrate all of this together to ensure that you reach the different segment of the audience that you're dealing with. And the language to adopt also must take into cognizance the fact that there are different levels of audience that you're talking to. So we've developed materials bearing this in mind. Materials in terms of physical printing materials and in terms of the messages through the media. And then you also have to know that this issue deals more with the youth. So social media is a very important element in this integrated communication model that we are adopting. So we're going to do a lot of deployment on the social media, to deliver the relevant messages. So it has to be a sustained campaign. So we are going to a state, and in each state we're going to spend a week of intensive campaign. And we have divided states following the senatorial district. So we are going to go to any state. We're going to deal with the 3 senatorial districts in each state. The staff are now going to take over from us after that one and continue with, reiterating the message, to the audiences.
This public sensitization campaign is predicated on the very simple fact that the national healthcare policy revolves around the issue of food and drug information safety. The information is very cardinal towards the realization of our cardinal objectives for the overall healthcare delivery system in Nigeria, because at the heart of the national healthcare policy is the prevention of illnesses. That is the major thrust of the national healthcare policy in the country. And to that extent, the Director General of NAFDAC, Professor Mojisola Christina Adeye, is very conscious of that strategic importance of food and drug information safety as the hub on which other activities should revolve around in terms of managing, in terms of dissemination of information to the generality of Nigerians. So this public sensitization, especially within the context of the COVID-19 pandemic, there have been all sorts of unregistered PPEs, that is personal protective equipment and also for managing the COVID-19 pandemic. So to that extent, we decided that it is high time we should organize this type of sensitization campaign, and to that extent we need to educate, sensitize, inform the Nigerian public so that we can equip them with the right information, because once somebody is educated, informed, well sensitized, then he becomes a small pocket doctor for himself or herself. Power. So this flag off is very symbolic to tell Nigerians that NAFDAC is intensifying its campaign, widening the scope, the horizon of our campaign. Don't forget that we've been doing routine lay educating Nigerians every week. And I'm very happy that even this platform, the NAFDAC and Your Health program, is that we do weekly. We want to scale it up further by going down to the grassroots level.
NAFDAC's war against falsified and unwholesome regulated products is a multifaceted one, and the agency under the leadership of Professor Mojisola Adeye is unrelenting in its pursuit of defaulters. She highlighted some of the different ways the agency is fighting these battles on several fronts, from discouraging the importation of unwholesome food and drugs to the problem of drug abuse in the country, and so on.
Before COVID, there have been issues with unwholesome food and substandard falsified medicines. NAFDAC was shut off from the ports for 7 years, 2011 to 2018. And cabals were formed at that point, and we are undoing the structures as we speak, but it's not something that we can disassemble overnight. Before COVID, we have a prevalence of about 17% of substandard counterfeited medicines. Because of COVID, what I would call the merchants of death try to use the pandemic because India shut down its doors, China was battling COVID, and those were the two countries where we get most of our medicines. And when there is a limitation in terms of access, then you have people trying to falsify medicines to make them available. Right now, we have not taken any survey since the pandemic, but we are working with that number 17%. But what we have done is to be very creative, to go to the source of where these drugs come from, which are China and India. And since 2020, March 2020, actually we went to India and China and read the Riot Act to them in terms of what they want to, what they are planning to bring or what they bring to our country. And they got the message, but nonetheless, we have apprehended over 70 products. I'm not talking of one container, because one product can be 20 containers or whatever. So we are using a multifaceted approach to reduce substandard falsified medicines on wholesome foods. The Federal Executive Council approved a device that is that you can use in the market to know whether the medicine is falsified or not. We are going through the process of procurement in order to make that available throughout Nigeria.
The event marked the official flag-off of the sensitization program, with the DG NAFDAC, distinguished legislators displaying some of the publicity materials for the project. That's our package for today. Please join us same time, same station next week for a fresh edition. In the meantime, if you have comments, complaints, or you want to report activities of fake drugs or adulterated food products peddlers, our doors are always open. You can reach NAFDAC via toll-free numbers. For inquiries, call 0700 162 3322. For complaints, call 0800 162 3322. You may also email NAFDAC at nafdac.gov.ng. If you have complaints about any form of misconduct, you can reach the Reforms Unit via email reforms@nafdac.gov.ng or call the Reforms hotlines on 0909 763 0506 or 0909 763 0507. NAFDAC, customer focused, agency minded. COVID-19 is real. Please ensure you and your family follow safety measures as outlined by the NCDC. Stay away from crowded places as much as possible, and if you must be out there, please wear a face mask. Wash your hands regularly with soap and water and ensure you use only NAFDAC-approved alcohol-based hand sanitizers. Taking the NAFDAC-approved COVID-19 vaccine is safe. It's our best bet of stamping out the deadly coronavirus. And don't forget to download the MedSafety app from iOS or Play Store to report any adverse reaction from the vaccine or any other medicine at all. See you next week. Stay safe.